We'll get to that. But what about the president's involvement? Number one, this super PAC ad is run by a super PAC. It's essentially former Trump campaign officials who formed this super PAC to protect and defend the president's agenda. Now they're jumping in, and it's noteworthy. They could have attacked Ted Cruz. They could have attacked Rand Paul, but they decided to attack a moderate Republican senator from Nevada, perhaps the most vulnerable Republican. What signal does that send within the family?
Well, it sends a signal. It's really interesting to see this. So, I mean, I covered Nevada politics pretty closely when I was at the Las Vegas Sun, and these sorts of ads, I mean, there's always very intense primary contests there, and the moderate Republican always comes out of them winning, basically. So it may not work as well as they're hoping with Heller, because Heller's real concern is that he's running in a state that's a bluish shade of purple, and he knows that going forward. And he also can look at a track record of having survived these sorts of primary challenges if they find somebody who doesn't have as much recognition as he does. But in general, for the party, it sends a message that if you don't fall in the party line, if you start to go more towards the center, we are going to come after you immediately. And that it's more forgivable to take the stance of, yeah, full repeal, go further to the right, go further to the right. All of this talk about let's come together that we've been talking about, you know, in the aftermath of the Scalise shooting and everything like that, that doesn't apply.
Yeah, that disappeared pretty quickly.
There basically is no involvement right now from President Trump or this White House. The Legislative Affairs team is working on this behind the scenes, but Trump has been pretty hands-off, which is a pretty big difference from how they did it in the House. They basically put the ball here in McConnell's court. As this was moving from the House, I had heard from senior House officials frustrated by a fledgling White House trying to get involved in a process that they weren't familiar with in the legislative process. They were inaccurate on their vote counts, if not, you know, a certain amount of credulity dealing with the Freedom Caucus. So now they put this in McConnell's court. We could see a push here at the end from President Trump, and probably will. But that's not going to help them save the blame, or avoid any blame.
Not involved in the detail of the negotiations, yet involved in the political context about this. And so to Mano's point, if you're a Republican and you might have to cast a potentially career-changing and for some potentially career-ending vote in 3 or 4 days, first you have the president tweeting yesterday, I cannot imagine that these very fine Republican senators would allow the American people to suffer broken Obamacare any longer. Okay, relatively just a little nudge to Republican senators here. But here he does an interview this morning with Fox and Friends, and he's asked about a Facebook posting that former President Obama put up, essentially saying, you know, what the Republicans are trying to do is mean. And listen to the president's answer.
They actually used my term, mean. That was my term, because I want to see, and I speak from the heart. That's what I want to see. I want to see a bill with heart.
He actually used my term, mean. The president had a Rose Garden celebration saying the House-passed bill was the greatest thing since sliced bread. Then he called it mean. If you're a House member and you cast that vote, guess what? Those words are coming back to get you in a political ad. If you're a senator who has to decide this week, and you see now the president confirming, remember the White House said, oh, that's not what he meant, then they ran out there to say he didn't really mean mean. Now the president's essentially confirming, I called it mean. What confidence do you have if you're a senator about to cast this vote that the president, who has sway with the Republican base and his base, has your back?
Yeah, the message you can take away is that they're playing hardball, that right now the focus is on the politics, not the policy, and that this is, in many ways, the Senate version of what the House did. And the messaging for that was, let's just get a bill passed and we can work out what the real bill is later. So again, a repeat of this, asking senators to go on the board with something that is not going to be ultimately, in the end, what passes. And that's part of the problem. And I agree that the only way to do this is to bring the right in. Okay, but if the stakes are very different now, because if the Senate passes a bill, the message back to the House will be, you have to pass the same bill. Yes. Right. We can't go through this again. Yes. And so then you're changing healthcare law. Then you're changing law. And if you look at the Senate bill, I just want to put this up there because the policy matters. Yes, this is not a full repeal of Obamacare, what the Senate is looking at. It would repeal the taxes created. It would repeal some of the subsidies for out-of-pocket costs. It would repeal the individual mandate, and it would repeal the employer mandate. So that part of Obamacare gets pulled out. It would change Medicaid expansion. That's what the moderates say it goes too far. Conservatives say it doesn't go too far enough. Changes some of the tax credits. It would allow states waivers on that big question of essential health benefits, what must be covered in your health insurance policy. It takes away Obamacare prohibitions on annual lifetime limits on insurance coverage. A lot of people don't like that because states could opt out and essentially restrict people. And it changes health savings account rules. It keeps the pre-existing conditions policy roughly. There are some changes there. And you can stay on your parents' health insurance until you're 26. That's roughly the same. Keep might be a little bit strong there. But the
policy here matters because if the Senate passes this bill, the argument is then you go to the House and you say, we can't change this. We just got this through the Senate. Mike Pence would likely have to cast a tie-breaking vote, do it or not. Mark Meadows out at this Koch retreat was saying 2 amendments, they could have this whole thing done by July 4th. I suspect that's a tad optimistic.
Yeah, very optimistic. They got to get it out of the Senate first, and that's still going to be very difficult. But I think what was remarkable to hear President Trump acknowledge that he called the health care bill mean. The problem for him is that he's not ideological about this. He does not have a really firm view about how he wants the healthcare system to look, what he wants it to look like. But there are members of Congress who do. They feel very, very passionately about healthcare policy, and they have a very staunch ideological view about the direction that this is going. People like Rand Paul, who believe that the subsidies in the tax credits in this bill will be more generous, will actually be more expensive than the subsidies in Obamacare. These are fundamental policy questions that the White House, the president himself, does not want to engage in. A key question, of course, is going to be when the Congressional Budget Office releases its estimate as early as Monday, Tuesday. How does that affect the vote even more? It could be pretty bad.
Because then you'll have a number saying how many millions of Americans lose their health coverage, what this does to the deficit. Do premiums go up? Especially one of the big questions here for the president. Does he turn on this piece of legislation when he sees that many Trump voters, elderly Americans, may have their premiums go up? So this tight, compact schedule this week, but several chapters as we go.